Hello, my name is Dr. April Armstrong. I'm Professor of Dermatology and Associate Dean for Clinical Research at the University of Southern California. Today, I talked about what's new in JAMA Dermatology. There are a number of different great articles that have been published since we last connected, and I wanted to highlight a few that might be relevant clinically. First of all, there is a new therapy that is currently being developed to treat molluscum contagiosum, and specifically for this particular new topical therapy, it is a nitric oxide releasing gel called berdazimer. And what was shown is that in patients that was treated with this nitric oxide releasing gel, about a third of the patients achieved complete clearance of their molluscum contagiosum by 3 months of time. So I think as a field, we look forward to having a topical option for our patients with molluscum contagiosum. Another article that I highlighted is the use of itraconazole for patients with tinea corporis. We know that we have a number of different options for patients presenting with tinea corporis, and there can be resistance to different antifungals around the world. So if you're thinking about using itraconazole, this study looked at different regimen, 100 milligrams per day versus 200 milligrams per day versus 400 milligrams per day. And they looked at these different regimens over 8-week period of time to see what was most effective. The overall conclusion is that any of those 3 regimens were very effective. However, the rates for complete clearance was highest with a 400 milligram per day of itraconazole. Additionally, we also looked at a number of other articles that were published that had some clinical significance. For example, there was an article that was published using ustekinumab, for example, for facial discoid lupus, and that was shown to be highly effective. And the final part of my presentation focused on the off-label use of JAK inhibitors. Now, we know we already use systemic JAK inhibitors for atopic dermatitis. In addition to that, we also use them for alopecia areata. We looked at a few articles that were published in JAMA Derm looking at these oral JAK inhibitors and their use in other dermatoses. For example, lichen planus, and this included oral erosive lichen planus all the way to nail lichen planus. And interestingly, these studies have shown that these JAK inhibitors, oral JAK inhibitors, have been found to be effective in these case reports in those particular patient populations. In addition to that, other off-label use of oral JAK inhibitors included vasculopathy as well as Darius disease. So as you can see, we as a field are trying JAK inhibitors in other indications for off-label use. And for a number of these orphan inflammatory skin diseases, they have been shown to be effective in these case series. I hope that you have found this to be helpful, and thank you for your readership for JAMA Dermatology.